Hi everyone, today I am going to talk about blood analysis, and in this session mainly focuses on two different diseases which is highly related to blood, that are anemia and leukemia. First one is anemia. It is a condition in which there is a deficiency of red blood cells, or it can be said as low level of hemoglobin. So hemoglobin plays a major role in our body, that is to carry oxygen throughout the body. If hemoglobin level is getting lower, the body does not get enough oxygenated blood, so this will lead to tiredness, shortness of breath, etc. Apart from all other reasons, main cause of anemia is low level of iron in the body. So our body needs certain amount of iron to make hemoglobins. If it lacks, it will result in the condition called anemia. So based on MCV level, anemia can be categorized into different types, particularly in normocytic anemia, microcytic anemia, macrocytic anemia, etc. So this picture shows the difference between a normal person and an anemic person. So RBC level will be comparatively low when compared to a normal person. So types of anemia. So there are three different types of anemias are there. First one is iron deficiency anemia, which is caused due to the lower level of irons. Mainly young women will be the victims of this kind of anemia. Other peoples includes a person who suffers from stomach ulcer or colon cancer will leads to get iron deficiency anemia. So next one is aplastic anemia. This is a life threatening, and when compared to all other types, it is highly complexive one. So this aplastic anemia is mainly caused because of chronic exposure to the toxic chemicals in cancer treatments or infections, etc. So the next one is pernicious anemia. This anemia is mainly caused because of vitamin B12 deficiency. So vitamin B12 is also called as cobalamin, which is a water soluble vitamin. The main source of cobalamin is meat, fish, milk, etc. So mainly pernicious anemia will be caused only for strict vegetarian peoples, and also a person who is a long time alcoholic. So these are the peoples who will get pernicious anemia maximum in numbers. Otherwise this pernicious anemia will be lack in so many peoples. When we look about symptoms of anemia, anemia will not show much kind of symptoms. It will feels like tiredness, weakness, or it will looks like pale appeared colors, and in our body it will create the hair loss, weight loss, etc. Why it doesn't show much symptoms means, if anemia is long lasting in our body, it will adjust the oxygen level in our body and it will cope up with that. So anemia will not show much symptoms in any cases. So these are the pictorial representation of symptoms of anemia. So treatment for iron deficiency anemia and vitamin deficiency anemia, medications will be enough for treating these kind of diseases. But when compared to these iron deficiency and vitamin deficiency anemia, other kind of anemia of chronic diseases or aplastic anemia, sickle cell anemia, it needs chemotherapy, bone marrow transplantation, blood transplantation, etc. So next important disease which is we are moving to is leukemia. Leukemia is also known as the blood cancer. So cancer is said to be an unconditional cell growth in our body. So blood cancer, or otherwise called as leukemia, is classified into four different types, that is acute myeloid leukemia, acute lymphocytic leukemia, chronic myeloid leukemia, and chronic lymphocytic leukemia. In this acute myeloid leukemia, it leads it the enormous growth of immature myeloid cells in the blood or bone marrow will lead to acute myeloid leukemia, and immature lymphoid cells, present of immature lymphoid cells in blood or bone marrow will lead to acute lymphocytic leukemia. If the condition, or for acute myeloid leukemia or acute lymphocytic leukemia, if the condition is still moving, it will lead to chronic myeloid leukemia and chronic lymphocytic leukemia. So the symptoms which includes weakness, bleeding easily, a fever, chillness, infection, headache, vomiting, seizures, weight loss, shortness of breath, etc. So the main reason or the cause of leukemia is smoke or exposing to the radiation or certain chemicals which is highly toxic, or having radiation therapy or chemotherapy, etc. Or if a person is having a family history of leukemia, that will also leads, and if a person is having a genetic disorders, it will leads to leukemia also. So these are the common symptoms and pictorial representation of the disease leukemia. So this treatment includes chemotherapy, biological therapy, targeted therapy, radiation therapy, and stem cell transplant. In this chemotherapy, it is a worldwide famous technique to kill the leukemia cells in the body. Next one is biological therapy. This mainly focuses on improving the immune system of an affected person to kill or to act against leukemia cells. In targeted therapy, it includes drugs to attack the cancer cells. And in radiation therapy, X-rays or high energy beams are used to damage the undifferentiated cells or that cell growth. So next one is stem cell transplantation. So it is a transplantation technology that a healthy bone marrow is transplanted to a person who is affected or who is having the diseased bone marrow. So these are the major treatment techniques which is involved to reduce the leukemia effects in the body. Thank you.